Among the challenges that remain to be tackled by the incoming administration are those related to COVID-19. For more on the tasks ahead, I have Professor David Kwak from Sooncheng University. Welcome back, Professor Kwak.
Good afternoon, Sunny.
I also have Professor Kim Moon-gyu at Yonsei University, live on the line. Professor Kim, it's good to see you again.
Great to be with you, Sunny.
Right, Professor Kwak, we'll start here in the studio. Korea's daily tally has hit well above 300,000 cases for the second straight day. Do you suppose Korea is now witnessing its peak?
Well, I'm dearly hoping so. But Korea, the government originally made the speculation that we might see the actual peak in about the second or third week of the March, which we haven't come into yet. So there's still the possibility that we might still further increase or rise in the pandemic wave. I'm dearly hoping that would not be the case, and I'm dearly hoping from this point on we'll only see the decline from the peak. But what happened in the past week and this week is that the numbers of the tests were quite increased due to the resumption of schools, and a lot of the people who were exposed to other friends around being tested, they also had to test themselves, and incidentally, a lot of the cases were found to be positive, just because the virus itself is really transmitting exponentially, and it's just transmitting to everyone. So I personally presume that most everyone who's currently going through any sort of respiratory symptoms is quite likely, it's quite probable that they're having the Omicron virus. So the numbers really don't reflect what's really happening, because only those who are tested will test positive in the PCR testing, and there would be many more people who have not tested and who hasn't come up in the wave and the graph that we're currently drawing. So I'm still dearly hoping the actual numbers who are going through the disease would start to decline from this point on, but we would have to give it about a week or more to really see it actually happens.
Right. And Professor Kim, what, meanwhile, are your prospects with regard to Korea's COVID-19 situation 2 months from now, that would be in May, when the Yoon Seok-yeol administration enters office?
I think Omicron will remain an issue of the current government. Actually, there are three factors affecting the pandemic: the human factor, virus factor, and the government factor. First, the human factor, the past 2 years of successful quarantine measures was very good, but it showed a very limited level of natural immunity. Second, virus factor, now we are facing Omicron, not the Wuhan strain, which is highly transmission and low severity. So the past quarantine measures are not so effective. And third, the government factor. Most of the quarantine measures were determined by some political initiatives. For the past few weeks, easing social distancing measures despite the surge was embarrassing. Now about 10% of Korean population got COVID, but must be 2 times higher or even more in real situation. That gives me a suggestion that Omicron is going to increase in a few more weeks to come if we maintain current policy, then decline.
Right, I see. And Professor Kwak, during his campaign rally, President-elect Yoon Seok-yeol vowed to lift business restrictions on drinking and dining establishments as well as entertainment venues. What are your thoughts on this pledge at this juncture in our fight against Omicron?
Well, I actually agree completely with what Dr. Kim has just mentioned, that it's quite regretful that we are rushed into easing the social distancing guidelines when we are actually we have not come into the peak of the wave yet. And I think it won't be too late if we still remain observant for a little more while and actually take any actions after confirming that we're safe to do so. I think at the current state, when we have 11 p.m. Curfew hours and most everyone's really going about their daily lives as regularly as possible, I don't think it's going to affect that much economically speaking. I'm not an expert in economy in any ways, but I don't think it's going to affect us in any ways if we delay the further easing of the restrictions further on. particularly because we haven't came any close to the peak of severe rates yet, let alone the death rates, because that's bound to happen 2 weeks after the actual confirmatory cases that happens before. So what we're seeing is when we have not gone into the peak of the actual wave yet, that means that we have not gone into the peak of the death rate and the severity rate that is about a couple of weeks to in the future to come. I'm dearly hoping that it'll stay mild, but there is still a great chance that because already we're seeing about 12 to 1,300 cases, 11 to 1,200 cases of ICU capacity that's being filled, that's bound to increase a lot, very steeply in the near future, let alone we're seeing steep rise in the death rates as well. We're seeing daily cases of 150 to 200 every day. Those people are not being admitted in a hospital. Those people are actually dying every day. And that's bound to actually increase. So I don't think now is the greatest time to really talk about easing further of the social distancing guidelines. I don't think there's no way of actually going back either. But at this point, we need to stay observant for at least couple to three more weeks and see that and confirm that we do decline in the actual confirmation cases. And also we have the capacity to handle severe cases in our units. Then we can make sure that we are in the safe place to go ahead with the easing of the social distancing.
Right. And keeping in mind the concerns raised by Professor Kwok, Professor Kim, there is indeed still much debate over plans to further ease social restrictions. Critics claim it's premature given the current overwhelming caseloads, while advocates assert that such containment efforts are futile in the presence of Omicron. Either way, do you believe, Professor Kim, that there needs to be a tangible shift in strategy?
I hope that the new government should make decisions scientifically based on evidence and listen to the experts. It's time to be concerned for severe cases. Omicron outbreak is something hard to manage compared to one original strain. If we want to remove quarantine measures, first of all, we have to ask ourselves, are we ready to treat with severe cases in a huge number, and including infants? Building up manpower who can care for severe cases take a long time and a lot of efforts. And if we have these, also we might have to run the facility in a very flexible way in non-pandemic times. So that means we should have a long-term plan also. I hope that the new government understands this situation.
Right. And talking about long-term planning, Professor Kwok, what do you propose with regard to the burden of treatment costs for severely ill COVID-19 patients who face a prolonged fight against their infection?
That's actually a very realistic question that we're already facing in the medical sector. If I may give an example, in my personal acquaintance who is a neuropsychiatric doctor, one of the patients who have been admitted before getting COVID-19 infections were sent off to the COVID-19 treatment center. He or she had to stay there for quite a while, came back with the rather long-term sequelae, remaining side effects from the COVID-19. Currently has come back to the neuropsychiatric department, is being treated for his or her original disease, but has still the remaining effects from COVID-19 as well. So that brings us this question to how much of an extent that patient could be afforded by the government, because COVID-19 originally has said to be really supported by the government. I think there would be a limitation in the length of time and also to the cost for which the government actually can support, because we cannot start treat everybody who's had COVID-19 for any remaining sequelae, meaning there would be patients who's had comorbidities, who's had cancer, who's had other types of diseases that coincided with COVID-19, and it sort of intermingles that it cannot be distinguished apart whether the remaining symptoms is actually due to his or her original disease or COVID-19 itself. I think eventually we'll come to a place where it will become to be treated treated just like any other diseases where government supports a certain huge portion of the total bill, but the patient actually has to pay a smaller portion for his or her own medical bill. I think that will eventually become the case, but at least for the time being, we still have to focus on doing our best to really treat these critical cases at the point. But eventually, when the new government takes over, that'll be something for them to actually think about.
Right, it will. Meanwhile, Professor Kim, on the testing front, authorities, I understand, are looking to scrap the need for double verification via a PCR test with regard to COVID-19 infection by acknowledging positive rapid antigen test results if they have been conducted by a medical expert. What are your thoughts on this?
Reports show that the sensitivity for rapid antigen test is around 70% or less, but specificity is more than 99%. In other words, negative results cannot say you are free of Omicron, but positive results means you are more than 99% infected with Omicron. Personally, my daughter got Omicron and she was negative with rapid antigen test, but 2 hours later, she was positive in PCR. I think only positive results with rapid antigen test can replace PCR in non-high-risk patients. We have to worry about the false positive rate, but this is around 0.05%, which is very low. So generally, rapid antigen test is not suitable in a hospital setting, but we can use it in the public health centers.
Right, to ease the burden on testing, of course.
Yes.
Meanwhile, Professor Kwak, the new incoming administration has also spoken about the need to bolster the medical infrastructure to better tackle pandemics such as COVID-19. What are your words of advice with regard to this new initiative?
Well, I'm gonna have to make a bunch of statements that are quite personal to myself, and I fear that I might get attacks from many different watchers who disagree with me. But the fact that we're losing a lot of these manpowers in certain areas of medical sector, especially in the pediatrics, especially in the cardiac surgery, the main reason is because they're not compensated righteously. So they lose interest in going into such departments to really take care of those patients who are vitally unstable, who need major treatments. Instead, they decide to go into something easier and milder where they can have their own personal life along with getting deserved compensation, so to say. That's an area where it's strictly controlled by the government in this country. And if they do not correct it, coming up with more manpower is not going to necessarily solve the problem, because more men coming out of the schools will actually decide to go into easier stuff still. If they don't fix this core problem that the people who actually deserve to be compensated more for their hard working, not just the labor, but also their dedication, if it's not fixed, we keep going to lose medical personnel that decide to really care for people. I think, and I'm hoping that the next government will take this into a deconsideration and really look at this in a righteous and a greater picture, that the main core of the problem really lies within the structure itself rather than something of the numbers. So I want to emphasize that point here today.
Right. And Professor Kim, President-elect Yoon has also highlighted the importance of supporting Korea's broader ventures on the vaccine and treatment fronts. How do you respond?
We don't know about the future. We may encounter future pandemic, but we do not know when, where, how, and what kind of pathogen. Taiwan has an expert committee who can communicate with the president directly. So that is the reason why Taiwanese government was very fast working against this pandemic, even in the middle of December 2019. We need to build up research infra, including basic research for vaccine and drugs. And we need a huge fund for clinical trials. I will give you an example of chickenpox vaccine, which was developed in Japan in 1986, and Korea licensed it in 1988, 2 years later. But CDC in USA did not approve it until 1995 to protect domestic companies. Korean government did not wait for CDC results at that time. But for this pandemic, we need to wait for a long time for get those vaccines. So if we need a vaccine, evaluate in an expert committee, produce it, or if not, import it as soon as possible. That should be a policy.
Right. And Professor Kwak, speaking within your capacity as a doctor as well, what do you believe should be the priority of the pandemic tower control, or control tower that is, that the new government plans to set up once in office?
I think I can word it in a simple word, really. It's refining the protocol. In the beginning phases of the pandemic, we were far advanced than many other countries because we were able to come up very quickly with the testing method and also the manufacturing power behind it. It mainly happened because we experienced MERS and SARS before. Even though we did not had written it down in the document as a protocol, but we had brain powers and manpowers who experienced it, knew how to gather up people and quickly react to what was happening at the time. Something like this probably and hopefully will not happen for another 100 years or so, but we need to prepare ourselves for the hardest and the most difficult. And that can only be taken care of really efficiently if there is a protocol that we can follow very safely. And I'm hoping that the new control tower, when they come in to place, they will make a very firm protocol that everyone can follow easily word by word. And if that is done so, we can manage any sort of future happening diseases, whether that be for infectious diseases or whether that be something else. So I think making up and coming up, establishing the protocol righteously is the most important.
Right, and talking about fresh efforts, Professor Kim, in what direction should the Yoon administration's COVID-19 strategy seek to flow?
I ask for one thing. I hope that they have open ears, open minds. I hope that they make real efforts to build up an expert committee dealing with ICU beds and long COVID issues. And as I'm a pediatrician, I wish that we can empower the pediatric healthcare system. And since we might encounter another pandemic in the near future, and Korea is close to China, which has many outbreaks, we should have a flexible long-term plan to control future pandemics, increasing the ICU facilities and manpower.
Right. Professor Kim, we have a bit of time left, so I'd like to ask you one other question. Speaking about efforts to deal with pandemics, where do you stand on the debate with regard to second booster shots for adults on the premises that this current pandemic will turn endemic in the near future?
Most of the scholars say that if you got infected, that means you have one shot of vaccine. So if you got infected, you might have two vaccines, and totally that means you have three. But after the third shot, I'm not sure when should we have the next one. My personal opinion is about 1 year, but since Omicron is the major pathogen of COVID-19 in Korea, I believe that natural immunity infected with COVID-19 will be much more longer than we previously thought.
Right, and Professor Kwak, there are concerns that rampant infections across society are looking to disrupt essential services and work here in the country. Do you believe further shortening the quarantine period for COVID-19 patients could be one viable option to address potential disruptions?
I absolutely disagree with that idea. It is currently being thought that people who have COVID-19 usually start to dissipate their transmissibility into their third to about fifth day, about 90%. But that still have about 10% possibility the person could be spreading as much of the virus as in the beginning. So shortening the quarantine period is currently not the safest way to handle this. Rather, educating people better, because as we go through these eased restrictions, people are already being advised that they would not be repercussions if they don't follow the social distancing. So they start actually getting ideas that it's much easier, even if they got infected, that they could go around with their daily lives. So if they're not going to really enforce their social distancing, I think it's the safest place that they at least remain during in the period of time that they need to be self-quarantined for, because otherwise, if they start going out, let's say 5th day and on, there is a much greater chance that the people could actually start to spread to others. But if that happens to people who are more vulnerable, let's say, who are confined in admission hospitals, who are solitary hospitals, then it'll become a dire consequences. We don't ever want that to happen. So I think it's safe to say, for the time being, it's still safer for people to be quarantined at least 7 to 10 days, and I'm hoping that'll stay more than 7 days, though.
Right, I see. All right then, Professor Kwok, as always, thank you very much for your time and your thoughts.
Thank you.
Professor Kim, thank you for your insights today.
Thank you very much.